According to the Department of Health 2017, 1 in 2 people are living with a chronic condition within Australia, in other words, half of the Australian population. The National Strategic Framework for Chronic Conditions 2017 was developed through collaboration between the Commonwealth and each state and territory governments of Australia. Its aim is to guide healthcare workers to provide more effective and coordinated care for those living with chronic conditions. Though it is targeted to the public health sector as a whole, it is relevant to us as future registered nurses as we make up part of this and we work closely and care for people with chronic conditions. I've had first-hand experience in caring for somebody with a chronic condition. Her name is Janice, a 67-year-old woman who was diagnosed with stage 4 breast cancer 7 years ago. According to the National Breast Cancer Foundation 2016, having stage 4 breast cancer or metastatic breast cancer means that the cancer tumours from the breast have moved beyond the primary site and have spread to other parts of the body such as the liver. This is a terminal diagnosis, and even though Janice has had chemotherapy and radiation treatments, she ultimately knows she cannot be cured. Though this diagnosis came as a shock to Janice, she has since come to terms with it and lives life to the fullest while she is able by spending time with her grandchildren and family. The National Framework for Chronic Condition 2017 has 3 objectives, and I have chosen Objective 2, provide efficient, effective and appropriate care to support people with chronic conditions to optimise quality of life. I have chosen this objective as stage 4 breast cancer is terminal and incurable, so providing effective healthcare to Janice to ensure she has a good quality of life while she is still living is most important. Within this objective, there are 5 priority areas which play a role in Janice's life. A registered nurse's role in each of these areas is important when caring for Janice. Number 1, active engagement. This is a very important part of Janice's care as she should engage and participate in her own health care. For example, she has the choice of stopping treatment when she feels is appropriate and consider palliative care when she feels ready. Young et al. 2011. Number 2, continuity of care. This involves Janice having access to consistent, holistic and continual health care throughout the different services she uses, such as an oncologist, palliative care team, nursing staff and members of the multidisciplinary team, Guthrie 2008. Number 3, accessible health services. Janice should be able to access any health services that she requires. This includes, where possible, facilities that are close to her home, as it takes a lot of her energy to travel. She should also feel comfortable within the facilities where she is receiving care. Number 4, information sharing. Engaging people with chronic conditions such as Janice in the ongoing monitoring, measurement and evaluation of health service performance to support continuous quality improvement will ensure a better patient experience of the health system and better outcomes. Number 5, supportive systems. Janice needs support from personnel outside of the hospital healthcare, such as occupational therapists to assist her within her home environment. In order to effectively implement this framework for people with chronic conditions such as Janice, a registered nurse must build and maintain a therapeutic relationship in order to provide care which is person-centered. Entwistle and Watt 2013. In doing so, Janice and other people with chronic conditions are able to receive efficient and effective care which allows them to have a good quality of life. According to the Department of Health 2017,